Welcome, everyone. Great to see everyone. Thank you for joining. I'd like to welcome everyone to the Road Behind and the Road Ahead, measuring the performance of 10 European governments on Alzheimer's disease. We're going to spend the next hour or so reviewing the findings of the index, and thank everyone for joining. We hope to increase our understanding of some of the bottlenecks and barriers, but also the pathways to help find better cures for Alzheimer's, to improve care, and even address prevention, and highlight best practices where we've seen them across many European governments. So I'd like now to welcome our speakers and our panelists. Is everyone here? Do you want to please introduce yourselves? Paola, let's start with you.
Okay, so first of all, I'd like to thank all participants to Alzheimer's Europe conference. Everything that you're doing during this conference all contributes to the wider awareness of the dementia and Alzheimer situation, and everything that you do during World Alzheimer's Month as well. Thank you, all of you, for having taken part earlier this month. It's so important. I'd also like to thank all the members of ADI who contributed to this index and to past indexes. This is a very important appointment now, and our partnership with GCOA is now in its 4th year. We have had some reports on the G7, an addendum report that included more countries of the C20. Then we've had a report that focused on 30 big cities in the world, and now, of course, this one on Europe. I'd like also to tell you that this is a big day for Alzheimer's disease internationally. There is a big meeting happening at the World Health Organization, and we are about to speak to this meeting. The meeting is focusing on healthcare system preparedness, which is very relevant to this report. And our point to the World Organization and to all the states attending today is that it is the fact that there has not been national plans in so many countries that, of course, has led to so much loss of life, confusion, and chaos in the first stages of the pandemics, that have also made such that a lot of vulnerable people, and many in our constituencies, have been hit so badly, in particular, as we all know, in the first stages in Europe. I would like, therefore, to tell you why the index is so timely, so relevant right now. There are new data on global prevalence and global cost that have emerged from WHO. Those were launched in September. There are emerging treatments, as you will have heard in the conference. There are important diagnostic breakthroughs. And of course, there is an aging population, also an aging European population. This is increasing demand on understanding what may be causing, memory loss, what may be causing cognitive deterioration, and eventually a diagnosis of possible dementia or Alzheimer's. And this is putting pressure on healthcare systems. COVID showed us, as I was saying, that healthcare systems are not robust enough, and the consequences of inaction are dire. So we must prepare now. Of course, we do have hope through treatments and diagnostic breakthroughs, but without preparedness, even hope, how are we going to implement the new ideas? Just to underline one point from the report, which I thought was really interesting, for all of those, and many governments speak to us and say, but we cannot do much about the Global Dementia Action Plan, about the national plan, there is not enough resources. So just one point from the index, this time on Europe. The index call for Europe, so higher income country, to do more training for caregivers, both formal and informal, because it's insufficient in almost all of the countries. So how hard can that be? One little step in order to make sure that people that care, the people on the front line at all levels, are better prepared, less stress, and can deal with what is coming much better. So I just want to leave you with this thought, and I want to give the floor back to Mike and to Sagar for telling us more about the index. Thanks so much.
Thank you, Paola, and we really appreciate it. And your point about the unfortunately near perfect alignment between Alzheimer's and aging is well understood across Europe. Taking action on it is a next step. And we also appreciate your point about the WHO and how we use that as a platform. Of course, their Decade for Healthy Aging is a very large platform inside Europe as well. So I'd like now to turn to Sagar to give us the findings of the report itself.
Perfect. Thanks, Mike, and thank you, Paola, for those opening remarks, kind of setting the scene here. So my name is Sagar. I'm a researcher here with the Global Coalition on Aging, and I'm honored to be here with you today. Over the next few minutes, I'm going to be providing a high-level overview of our 2021 Alzheimer's Innovation Readiness Index, which we launched earlier this month. Yeah, so at GCOA, we recognize the major demographic shift that's happening around the world, right? And we're a network of companies that are focused on solutions for our aging society, from health and pharma to financial services and home care and tech to consumer products and transportation. We recognize that this unprecedented aging calls for innovative thinking and urgent action, and the need to partner with stakeholders, advocates, local policymakers, and national and global leaders to achieve our objectives. So before I get into the details of the index, on behalf of GCOA and our partners at Alzheimer's Disease International, I want to thank Alzheimer's Europe for inviting us here today to preview this index. And I want to especially thank Biogen for funding and supporting this report as well. This index is, as Mike and Paolo mentioned, the first to focus on Europe itself, but it's the fourth, in a series of collaborations between our two organizations looking at different geographies. And the goal of all these reports, and this one in particular, is really to bring greater attention to the rising prevalence of Alzheimer's in Europe and its impacts, and also to highlight the key areas where the research suggests that action and inaction will disproportionately determine levels of national progress in the coming years. So the 10 countries we looked at were selected for a variety of reasons: their size, their influence within kind of the European context, and their position as global leaders. We also looked at the EU itself and included some case studies on best practices from a few of the countries which were not formally evaluated as part of this index, but were also deserving of our attention. As Mike mentioned, with the demographic changes that are taking place across the region and the momentum being generated not only by the European Commission, but also the UN and WHO, with the kind of 2020 to 2030 being the decade of healthy aging, we really thought this was an opportune and critical moment for Europe to step into more of a global leadership role on Alzheimer's innovation. So in terms of the sort of utility of this index, right, it's got a number of different uses by a range of stakeholders, from researchers and advocates to experts to policymakers. First and foremost, we hope that it'll help bring greater attention to the rising prevalence of Alzheimer's disease and other dementias in Europe, and a better understanding of the impacts of these diseases. As a data-driven tool, the index can assist with benchmarking and priority setting. It can help highlight and amplify best practices where they exist. And then more broadly, we think that the index can help support renewed commitment at the country level for folks to lead on Alzheimer's care and innovation issues. So just some process here. So the report is based on primary and secondary research that our team conducted from December 2020 through June 2021. We conducted surveys and one-on-one interviews with a number of global experts who helped us identify key challenges, country-level developments, and opportunities at the national level. All of this research was, of course, supplemented by extensive desk research drawn from external reports, national databases, and then there's some original country-level research and findings as well. So our team kind of collected all this information and organized it into 5 broad categories for evaluation. So the first category, strategy and commitment, captures 1, the high-level policies, 2, political commitments, and 3, investments that are happening at a national level. Early detection and diagnosis looks at government-driven efforts to increase rates of early detection and improve diagnosis. Access to care, of course, measures the level of access within a country to appropriate medical care. Awareness and monitoring looks at how seriously governments have committed to prevention and risk reduction efforts. And finally, care standards and settings helps evaluate access, innovation, and government commitment to national care standards and care settings. Across all this research, we collected 120 metrics that were all scored on a 100-point scale. They were then grouped thematically and then equally weighted, and then ultimately summed to create an overall score for each country, which is also out of 100. And of course, none of this would have been possible without the continued support of our advisory council, who I'd like to thank and recognize throughout this process, from identifying and sort of shaping the categories to reviewing the draft, connecting us with experts. This advisory council, which was made up of members, cross-sector experts from various countries, helped provide us with some invaluable insights and guidance all along the way. So, in terms of just kind of the top level findings, across all of the research and conversations we had, there were sort of three needs that emerged most clearly. First, countries really need to pass or renew their national plans that set forth concrete, attainable measures to address the growing needs of people living with Alzheimer's and their caregivers. Second, governments need to move beyond the creation of plans and actually secure funding to implement the key planks within these plans. And third, we need a new era of advocacy that's driven by political champions at both the regional and national levels. So the first category we looked at is strategy and commitment. And our research team examined several key factors to inform these scores, including 1, quality of national plans, 2, funding for relevant programs, and 3, overall political attention being paid to Alzheimer's disease and dementia. And across the 10 countries, we found a general lack of consistent funding to address the growing challenges posed by Alzheimer's, with most national plans not receiving the commensurate funding needed to actually implement their key programs. And we also saw that COVID, of course, has played a complicating role here, with attention and resources being directed elsewhere. And of course, within each of our highlighted categories, we also provided specific calls to action that were relevant to most or all of the countries. So for the first category, strategy and commitment, the largest pitfall we saw here was that resources and funding to execute national plans are not being properly allocated. In the early detection and diagnosis category, it was revealed that some of the largest opportunities for growth, with all countries facing barriers to early detection and intervention. And here, access to tools and training for general practitioners remain large barriers in most countries. And we also, of course, saw that stigma remained pervasive in almost all the countries as well. In terms of calls to action for early detection and diagnosis, the index uncovered that most effort is needed to improve GP training so that they're able to better diagnose and then also more or sort of better refer patients to appropriate specialists. We also found that currently this lack of GP training is really bottlenecking patients on the care pathway, which is a huge challenge. And then in terms of access to care, even though most countries scored relatively well here, but there were still important differences to be found. And we saw a lot of geographic variation in access to care within countries as well. Calls to action for this section, we found that all countries need to work to better mitigate these internal disparities in access across groups, and then also work to provide additional services. One example is, post-diagnostic support is not common nor well implemented pretty much across all the countries that we examined. So looking at awareness and monitoring, we found that most government support for awareness efforts is kind of ad hoc in nature. It's inconsistent or not sustainably funded. And as a result of this, national associations and other third-party organizations, not governments, have had to be the primary drivers of these awareness campaigns. We also found that overall, most of the countries we examined are struggling to monitor dementia effectively. In terms of actions, we found that governments need to work harder to either partner with these national associations or third-party organizations to develop their own communications to increase literacy and awareness about the risk factors. And then also governments really need to invest in infrastructure for better monitoring and surveillance. And then in this last category, the care standards and settings, we found that there's a lot of variability both across and within countries. Across all countries, it's clear that care pathways remain undefined and unspecific to Alzheimer's and other dementias, while informal caregivers remain heavily burdened and just generally unsupported by national policies. So in terms of calls to action here, we found that governments and healthcare decision makers need to work to develop clear and navigable care pathways that prioritize the person and integrate different aspects of care. Governments must also work with cross-sector partners to develop tools that can help lower care costs and the resources needed for long-term patient monitoring. In addition, national governments can work to build more of a focus on innovation, generally within Alzheimer's care, promoting new tools and frameworks for patient-centered approaches, as well as guidelines and best practices for care pathways. So in terms of a kind of a recap or overall summary, we found that concerted action is needed across Europe in order for those living with Alzheimer's and other dementias to be diagnosed, treated, and more effectively cared for. But the barriers we identified are not insurmountable. So I just want to say thanks again for having us. The report is now live and available for download on both GCOA and ADI websites. And I'll turn it over to Mike and our panelists for their discussion.
Thank you, Sagar. A great summary. It highlights so many of the important findings that we're going to now discuss. And I'd like to welcome everyone now to our panel discussion. Let's, when we opened up, we introduced ourselves, Paolo and Lorène, Debbie Abrahams and Pablo are not with us. So please, if you would introduce yourselves, and then we'll jump into the panel itself.
Thank
Debbie?
you, and apologies for the slight delay. We've got votes in the House of Commons at the moment. So my name is Debbie Abrahams. I'm a Member of Parliament in the UK. My professional background is as a public health consultant and an inequalities researcher. But currently, the relevance, I think, for today is that I chair or co-chair with Baroness Sally Greengrass, your party parliamentary group for dementia, and I have been doing this for a number of years.
Great. Well, thank you. And again, we're thrilled that you're here, and we understand the challenges you all have with so many responsibilities. Baroness Greengrass is an old friend, but personal friend of mine, as well as she's been a part of our advisory council at Global Coalition for a long time. And say hello to her when you see her next. Pablo, if you would introduce yourself, and then we'll jump into the questions.
Yes, hi, good afternoon. I have to say I was here for the last 15 minutes, but with my camera off. Sorry about that. Okay. Well, I'm Pablo Martinez-Lage. I'm a clinical neurologist with special interest in Alzheimer's disease and, well, all kinds of cognitive impairment. I'm working in the north of Spain, in San Sebastian, doing both clinical work and research, very focused on early diagnosis, therefore early treatment and prevention.
Fantastic. Thank you so much. And we're so thrilled on this panel to have a clinician as well. We really appreciate it. So let's jump in. Lorène, this, of course, is an index where we hope to set up some very positive and good competition between and among the European member states. France has been an interesting one. There was not too long ago, probably close to 8 or 10 years, president of that time, Sarkozy, was a huge advocate of Alzheimer's, both around in France, around Europe, and globally. Of course, we know that Prime Minister Cameron took up a lead when the UK led the G7. And of course, we have the World Dementia Council as one of the outputs of that. But where are we today in France, and how might this index be used to help push things along and highlight this very critical need?
Yes, indeed, Mike, the National Alzheimer Plan 2008-2012 you refer to definitely had a huge impact and enabled great changes on the field for people living with dementia and their caregivers. And after that, the ambition given to the Neurodegenerative Disease Plan 2014-2019 didn't meet the objectives. And even if today we work closely with the different stakeholders of this plan, such as France Parkinson, for example, or the MS Disease Association, we all know that the different diseases have specificities, and the people concerned have specific needs. So we must focus on those needs to build the right answers. And I wanted to say that the COVID-19 pandemic also definitely had an impact on the process following the end of the neurodegenerative disease plan. And we worked hard to build the future, but the roadmap running today still doesn't cover all the issues at stake. And with poor financial support, it is a great deception for all the stakeholders. And it is our common responsibility today to anticipate the increasing number of people living with dementia and the arrival of therapeutic innovations. And today for France Alzheimer, for our association, the index and the WHO Global Status Report on Dementia and the support of ADI and Alzheimer Europe are of great help to reinforce our advocating mission. And well, it is very true, because next year we have our national presidential election coming. So we are doing a huge work today to be heard. And the French government must recognize that fighting dementia is a public health priority that requires specific and ambitious answers with a strong political will and dedicated fundings, as the index showed also. And every day we lose because of inaction or because of lack of public support for great initiatives on the field. For example, it is precious time we lose for people living with dementia and their caregivers. Thank you.
Great. Well, thank you. Any way we can help, and this index can help in supporting the efforts in France and all around Europe, we are pleased to provide that. And to your point about the importance, and also relating to Sagar's opening of the near perfect alignment of Alzheimer's and other dementias to aging, if we do nothing about this, or we don't sufficiently address this, not only is it a terrible situation for patients, caregivers, and communities, but it becomes the fiscal nightmare of our 21st century. So it's a huge public policy need as well as a patient need. Debbie, from your point of view, as we look at the national plans, there are many, how do you see where those plans are, how, where there might be some good implementation, where there can be some additional better implementation? Maybe you can talk to us from your European point of view on the national plan perspective.
Well, certainly in the UK, you referred to David Cameron and the initiative that he set up in 2013, which with the G7 was made a huge difference. So I just want to sort of take a moment and say the importance of leadership. I mean, he was instrumental, and I'm a Labour Party politician, and I need to recognise, and I think we should all recognise the importance that in terms of the initiative that he set up there, and that start at a national level, but then internationally, I think has put us into good stead. But I have to again reiterate the ongoing need for leadership. So we have in the UK seen a slowing down, I would say, particularly around the importance of research. My APPG has just conducted an inquiry into the issues around research, particularly in terms of research during the pandemic, and how that has slowed down. So the global objective of having a cure by 2025, that is not easily within our reach now because of the issues with the pandemic and the implications for dementia research. However, there is cause for good news as well. So in the UK, we have a very extensive UK Dementia Research Institute, which involves a whole range of different centres right across the country, from London, Manchester, and elsewhere in the UK. And the importance of that collaboration as well, not just at a national level, but internationally. So, and I've spent a lot of my time trying to influence rather the leaders within our parliament, within our government, to try and fulfill their commitment to the Dementia Moonshot, to increase the funding as they promised in the general election manifesto by 800 million over the next 10 years. And if they're looking, if they only want to look at the bottom line and how that brings investment into the UK, we know that there's the potential of doubling private sector investment. For every £1 that's invested, it can lead to more than £2 private sector investment as well. So that, if that is an incentive, we have got the evidence around that as well. On care, I recognise everything that you're saying in terms of we have, as you will know, very good treatment plans for a whole range of diseases through the National Institute for Clinical and Care Excellence. However, how that then is translated into delivery on the ground is not always easy. And I think we also need to recognise the voluntary sector, the third sector, in the importance of providing a wider awareness, a public awareness around the challenges that we all face, and as a society we face, not just within the UK, as you rightly point out there, but also internationally, and the importance of collaboration there. Hopefully that helps, Mike.
It helps enormously, and thank you for all the great work you're doing, both in the UK and with your position around Europe as well. I'd like now to turn to Pablo. Pablo, if you could give us, from your perspective, what are some of the strategies that you would encourage? Where do you see some of the places we're falling down or barriers? You talked about particularly your focus and interest as a clinician in earlier detection. We know that, therefore, it's not only about biomedical research, but it's also about the use of technology and what we can learn from around what's happening in Europe, and where this index shows some of the best practices. So Pablo, if you could open with a few minutes of your thinking on this.
It's very difficult to focus the problem of taking Alzheimer's and dementia as a priority when you start to mix medical issues, social issues, media issues, and political issues. From my experience here in Spain, the national plan was DOA. It was approved with no budget at all. But I can say that when it was written, they committed the mistake of trying to include everything into the plan, from raising awareness to social research to biomedical research, going through ethical issues, early diagnosis, access to care. So it is impossible to set up a budget for everything in the dementia field and the dementia world. If you add that here in Spain, there's a Ministry of Health that some years is a Ministry of Health and Social Issues, and other years is the Ministry of Health and another Ministry of Social Issues. And you have the National Plan for Alzheimer's Disease developed by the social section of the ministry. And then that coincided with a national strategy on neurodegenerative diseases that was developed by the health section of the ministry and was written by general neurologists. So it's very difficult to really think that in Spain we have answered the call from the WHO or the European Commission to, as I said, consider Alzheimer's as a national priority. Talking about the barriers that you mentioned, I was really astonished by the results of the recent ADIO report saying that 75% of people are undiagnosed. We made a survey 10 years ago, very similar, and it turned out that, yeah, the percentage was somewhat around that. So we haven't improved at all in 11 years, no? So there are barriers in the citizens, in the citizenship, where we go too late to the doctor. But I think that is changing rapidly through social media and the press and TV. I think we are increasing the sanitary education of the population regarding early symptoms and the detection. But the problem is that the medical part is not ready to really give an answer to those going to their doctor saying my memory is wrong or something's wrong with my memory. And I'm saying this with shame, as you can understand. There's a very large lack of training among both primary care physicians and specialists. And I think that's not only in Spain, it happens similarly in other countries. That explains the lack of equity in access to diagnostic tools, to neuropsychology evaluation, of course, lack of equity in access to early treatment, early intervention, cognitive stimulation, and non-pharmacological therapies. And of course, a budget is needed for this, but you can't include a problem as big as dementia with other chronic diseases, because otherwise dementia is not considered a priority, but just another disease. So from my point of view, if a government or a parliament really wants to consider dementia as a priority, first of all, come to a consensus. Forget about your political colors and come to a consensus. This is a problem of the whole society. Second, call people who are experts in the field. Forget about general neurologists, forget about general psychiatrists. Call people who are experts in the field, both from primary care and specialty care. Be creative. A budget is needed, but you have very good teams working in your sanitary system. You only have to train them. You only have to coordinate the teams. You don't need to build big research centers or big specialized centers. You just need to train your teams in primary care and specialty care. And focus your plan in either early diagnosis, early treatment, or residential care or whatever, but focus your interest in 2, 3. I really envied the British plan and the French plan, because they focused on concrete problems. So there's a lot of research that is no research anymore, like biomarkers. It's not a question of research. They should be being used by all physicians, but they are not. Why? Because there's a lack of training. There's a lack of interest in the medical society into Alzheimer's. In neurology, everything is focused on stroke or multiple sclerosis or epilepsy, and there's no interest on dementia and Alzheimer's, because it is considered still an untreatable disease. And everyone forgets that there's a lot to do. I think I'm talking too much now.
Well, you've said a great deal of importance and taught us a lot to focus on and really highlighted a number of these points from the index. So thank you, Pablo. And Debbie, we have, of course, the perspective from the UK, which has a general application. Lorène from France, Pablo from Spain, but also from your point of view as a clinician, as a medical expert. So Paolo, I'd like to come back to you and thank you again for your partnership, the partnership between Alzheimer's Disease International and the Global Coalition on Aging in many capacities over a long time, but in particular over this European index. Maybe you can now bring us to where we are, the learnings from the index on early detection and diagnosis. You have the World Alzheimer's Report on diagnosis, which is out and connected to some of the findings of the index. So Paola, maybe you can bring this part of the panel session around to that topic, and then I'd like to have an interaction among all of us, please.
Thank you so much, Mike. It's been lovely to hear Debbie and Pablo and Lorène. So interesting, and of course, so high income country perspective. And of course, ADI, unfortunately, has to deal with many, many countries where you do not have not only the diagnostic equipment, but not only the research centers, but you don't even have geriatricians or psychiatrists, where sometimes you don't have teams and you don't have primary care interventions. So it's always very lovely to go back, and look at inequity. I know this is a big topic for Debbie as well. And inequality exists everywhere. I live in England. I know full well that also in England, there are people that cannot access these things, that don't even know they exist. So we have a big job on our hand. But let me tell you a few things that came out of that. So yes, the report, the World Alzheimer Report today was focused on diagnosis. And a lot of our thinking was around, well, there's going to be therapeutic breakthroughs. And therefore, it's important at this point in time that we do have a look. If people are going to ask for more diagnosis, as is likely, as soon as something comes on the horizon that may be a cure, then how are we looking at healthcare system preparedness? But as we know, the program is bigger than that. And Lorène, Debbie, and Pablo all touched on that. Pablo was mentioning the Spanish plan. Now, it's very important to us, and we need to rethink that. And this is why we are doing the index. We do need dementia plans. Why do we need dementia plans? For what Pablo said, dementia is really complicated. When I go and speak to governments, I don't know whether to go speak with the welfare people, the pension people, the health people, the public health people, if they have them, because so many things come to so many bits. And there is an element, and Pablo has touched on that, to bring back dementia to other diseases. So right now, whilst we're having this discussion, the WHO is once again talking about a lot of other things, but not considering dementia as the big problem. It is the 7th leading cause of death globally. And dementia is so complex that it requires its own plan. It cannot be put under a neurological plan or under a mental health plan or under a non-communicable diseases plan. And I could go on. It's something that needs to be looked at holistically. And in England, it has been looked at holistically, it's true. In France, it was looked at holistically, and then now is reverted to neurological diseases. In Spain, it's finally been looked like as a plan, but there is no money, like in Italy. So, wherever we look at it, there are challenges. But to do this kind of work, to do the kind of index work makes sense because it can equip members of ADI, can equip neurologists like Pablo or politicians like Debbie or activists like Lorène that can go back to their governments and again point out that some of these things we still have not sanated. When I was talking at the start of this webinar about the lack of training that also Pablo pointed out, that is a massive issue. There is a real breakdown of communication between government and their primary healthcare practitioners. A report of OECD in 2017 pointed out that only 12 hours of education are given in the general course of a degree on dementia. And how many years do these people study? 10? It's a real commitment to get a degree in medicine. So much, and this was in OECD countries, so much is still there to do. And the report, the index today, points out so strongly about the lack of training, the importance of getting training underway. And I do know that there are fantastic neurologists, geriatricians, psychiatrists that really are working with generally with activists and with civil society organizations. And I encourage them, and some of them will be listening to us here, to work even more closely, because really, unless this is societally, we make a leap forward and understand the complexity of dementia, we will not really help people that live with dementia and their carers. And it's such a shame that Helen Rochford-Brennan couldn't be with us today, because she would have made that point even more strongly. Ultimately, we have a responsibility towards the people that right now are having this issue. They cannot wait forever. They cannot wait for a therapeutic breakthrough. They cannot wait for blood biomarkers that may come on the market. They need to have something now. And at the moment, the only thing that works is care. So, you know, we also have to focus on care. Once again, Pablo was saying big decisions. Well, England has been taking that big decision on social care at a governmental level, that more money needs to be inputted in the sector. How can we do it? Only by all of us paying more into it. But this is a societal issue, and it has to be dealt as such. And now, as Pablo, I will wrap up and let everybody else have their say.
But it's great points. Thank you, Paolo. So we have about maybe 12 or so minutes left, just to give us all a sense. And I'd like to ask one quick question for anyone who wants to respond. And then we're going to go around again. And I'd like to ask each of you for the one or two takeaways you want everyone to come out of this relative to how this index can help us push policies forward. The one question I'd like to ask, if anyone wants to comment on it, is about data. Whether you think there's ways we can do a better job. I'm sure there are, but ways we can do a better job to capture more data, to use the data we have. Some of the feedback from the index, of course, alludes to that. But any comments on this data point, which is so critical, and obviously related also to the fact that we have technology, something we've learned during COVID, greater applications even. We're seeing that in many countries across Europe, Japan, here in the United States, we're using a great deal of the data, technology capabilities for data collection. So any comments on that as a way to help us get to good policy actions?
I'm not at all an expert in data technology, but I think a very good first step would be to come to a common language regarding the diagnosis of syndromes, the diagnosis of diseases. Again, it's a question of training. There are many physicians out there not entering diagnosis of MCI, for instance, into their medical and clinical records. We made a work and we published it saying that electronic records of public health systems are useful to give you good prevalence estimates, to give you good estimates of how many dementia patients are in the mild, the moderate stage. But again, I think we need a common language. Classification of diseases terms should be updated somehow in that respect.
Yeah, and you know, your point reminds me, I'm sure all of you, Paolo, ADI has done really spectacular work over the years in education, raising awareness, highlighting policy. But I remember probably pretty close to 10 years ago, you did one of the first, probably the first study, that time was a global study, Drs. Anders Wemo and Martin Prince. Anders, of course, part of our advisory council, did this really incredible methodological, innovative work to try to get a sense of actually what's in scope here, because there was so much we didn't know around who actually has dementia and what's the fiscal challenges around it, which of course gets to the point that, as you said, Paul, we want public health officials, we want social care, we want ministries of health, but we also want our finance and economic ministers to be part of this. Debbie, and Debbie, let me ask you to also now give your one, we're coming to a conclusion, so your point here and your one takeaway that you'd like to leave us with.
So yeah, as I say, former public health consultant, public health researcher as well. So I absolutely agree with everything that Pablo has said, and also Paola, I have absolutely on board with your comments as well. So I am driven by evidence-based policy. I'm unusual as a politician to actually be driven by that. Sometimes it is policy-based evidence that is actually required. But I think, given the multitude of choices that decision makers have and the pressures on those, and given the context that we are in within this global pandemic and how it has hurt economies, we also need, I think that was the point that you were coming on to, Mike, recognize some of the needs that politicians will have. So around the points that I was making, if we are, particularly in terms of the research side of things, if we we have a magnificent health and life sciences research sector in the UK. If we're able to show that we are able to contribute to not only work towards diagnostic tools, therapies and care interventions that will make a difference, but will also mean that we can stimulate our economy in this sector, then this is the sort of evidence we also, and the data that we also need to be collecting. Now, I've given you the figure, £1 of public money can generate over £2 of private investment money as well. So that the health economic side of things as well needs to be considered.
Thank you, Debbie.
I'll give that as my one.
Okay, thank you very much. Lorène, I'd like to come back to you and ask you, as we begin to wrap up, what's your main action point that you might take away from this dialogue back to France, and also recommend for all of us?
A lot of important things have been said, and it is a really great discussion. And on data specifically, we are trying to do better in France right now with our national Alzheimer Bank, because how can we pretend answering to the needs of people living with dementia and their caregivers when we are working on estimations? And what I take with me today is what I would like to add is that we are all concerned, and this is a global issue, and we have all to take the responsibility to see that if we don't act today, this is for the worst tomorrow, and that people with dementia and their caregivers cannot wait anymore for us to act. Thank you.
Very well said. Thank you. Pablo?
Well, I think my message would be for any politician that might be listening to us, because I guess everyone attending this symposium is aware of what we're talking. So my message is, cancer kills, cardiovascular disease kills, but Alzheimer's and other dementias cause years of severe dependence before killing. So this is a problem of everyone. This is a problem that should be faced by everyone. I think we can say that the teams are ready: social workers, nurses, family associations, primary care physicians, specialists, neuropsychologists, psychologists, journalists. The teams are ready. We need you politicians to lead the answer, to make the answer yours. The problem is big, but not that big. It can be faced.
Very well said, and I love the optimism. Yes, let's thank you. And that's really the reason for this index, to be able to, not to be critical per se, but to highlight the honesty of what's going on that we can point to that seems to be working, where are some of the gaps and even the barriers. And as we say, let's maybe a little bit of competition between and among the various governments across Europe is not a bad thing to address, to be seen correctly and adequately to address this huge pandemic of Alzheimer's. And it really is we've come to understand the definition of pandemic related to communicable diseases over the last almost 24 months, unfortunately. But in many ways, if you define pandemic as with respect to its impact on people and the numbers of people, and with Alzheimer's, as you said, Pablo, it's not only those who are, or you implied, not only those who are suffering, but the families, the friends, the communities. Paolo, what is your last thought on this, and how would you take away from this dialogue so we can use the index in a very positive way?
Well, I wish that, as Pablo said, most government knew what we were talking about. The reality is they aren't. As ADI is speaking tonight at the World Health Assembly, and we will remind governments, we never have to cease to make our point. And it's been lovely to speak and hear so many of you so passionate, because Pablo is right. We are doing this because we have hope. It's not that difficult. We can do it. We just have to want to do it. We just have to want to put the money to do it. We just have to want to put the love to do it. That's what we have to do. And we will do it. I think all of us working in these areas do that. There's been so much progress. You were talking about data earlier, Mike. I mean, look at what's happened this year with the launch of the research blueprint of WHO, with the launch of ADI from Gates Ventures. There are initiatives, there is stuff happening out there. It is hopeful, even in the research area, so that research centers like the great one in the UK can then avail themselves of more information from all over the world and do even better. So my message is one of hope. We will continue to publish that. ADI will continue to collect data. We now know that what we did 10 years ago with Martin Prince and Anders Vimo, the 1066 project, is even more relevant because nobody is collecting primary data anymore. So we do need to spend more time collecting primary data all over the world. We don't have the funding to do that, but we are hoping, and we will try and make sure that even the littler country that absolutely cannot provide these is served in some way or other. We need to do that. It's important that we think of solidarity when we're looking at our movement. And we is a movement. Everybody has listened to us today, has participated in World Alzheimer's Month. There were 45 million people doing that, a lot of people. And so we can do even better than that, I am sure. That's my last thought. Thank you, Mike.
Thank you. It's a great last thought, and I'm not going to try to go beyond that. I think that's a great place for us to conclude. Sagar, I know we've made the index available to everyone. We welcome people to use it. We welcome people to use it as a tool. Governments themselves, we hope, will look at it and will continue to use those indicators as measurement of hopefully progress. So thank you to all, Debbie, Pablo, Paola, and Lorène, and Sagar. Thank you very much. And on behalf of the Global Coalition on Aging and ADI, Alzheimer's Disease International, we're thrilled with being part of this Alzheimer's Europe project, and hope that this session was helpful to all of us. Thank you again.